website on the strategic planning pages. We will start today with an introduction from Commissioner Kastner, and then we'll turn it over to the Regional Director for the New York City area. Once the Regional Director finishes their presentation, which should take about 15 minutes, we will turn it over to the people who have signed up to provide their verbal feedback on the questions that were provided on the invitation. We will not be responding to any questions asked at this time to ensure that we have enough time for everyone that signed up to speak. If you do have questions that you need answered, please email them to info@opwdd.ny.gov. I'd like to now turn the program over to Commissioner Kastner. Commissioner?
Thank you. Hello and welcome this evening to OPWDD's Regional Forum on both our 507 plan and the American Rescue Plan. This is the fourth of 5 separate forums that we're holding around the state to hear from the people we support and their family members directly. These events are being held in order to give us an opportunity to hear your ideas and suggestions for setting OPWDD's strategic priorities for the future through our 507 planning process. We also want to hear your ideas for how we can best use funds from the American Rescue Plan to support home and community-based services. We will also be hosting about 35 events with various stakeholder groups around the state and gathering their ideas as well. And finally, as you've heard, we've set up a dedicated planning email address, which is planning@opwdd.ny.gov for people to use to send us their thoughts and suggestions. Anyone is welcome to submit their comments using this email address. At the conclusion of the process, we'll gather all of the input we've received through the spring and the summer, and then use it to develop our 5-year comprehensive plan, the 507 plan, which is named for that section of the mental hygiene law that requires it. This plan will be our roadmap, guiding our agency's activities and initiatives moving forwards. We will also be using your input to develop a plan for how we allocate our share of enhanced federal matching funds available through the American Rescue Plan. So again, thank you for joining us in this important work. Your voice matters, and OPWDD is excited to listen. I want to assure you that I'll be on the call for its entirety and listening, even when I glance down at my computer while I'm typing my notes. So I now would like to turn the forum over to our Regional Director, Delia Tucker, and we'll get started. Thank you very much for being here. We look forward to hearing your comments.
Thank you, Commissioner. Hi, everyone. My name is Delia Tucker, and many of you may already know me. But for those of you that do not, I am the Regional Director of this OPWDD region, which includes all of the boroughs of New York City. And as many of you also know, our regional offices are typically the first place people go when they access services through OPWDD, and the place they continue to come back to as their needs change throughout their lifetime. I want you to know how important it is for you to take part in this process, to ensure that we are providing you quality supports that you need and want, and creating equitable, accessible, and sustainable supports for the future. We need your feedback to help guide us. The people we support and the families who also support them are the most critical and important part of our service system. This system was built for you and by you, and we want to continue to ensure that we can keep meeting your needs with your guidance. The way that we usually get the opportunity to hear from you is through our regular public committee meetings that are advertised on our website, our social media pages, and through our mailing list. But today, we're here to launch another way for you to provide feedback. The New York Mental Hygiene Law requires that OPWDD, along with our sister agencies, the Office of Mental Health and Office of Addiction and Substance Abuse Services, develop a 5-year comprehensive plan, which is then reviewed annually. We know OPWDD hasn't updated our 507 strategic plan for a few years, which is why we're here to correct that oversight. And we know that many of you, as well as our own staff, look to the 507 plan as a guide for our future. It helps set a path and expectations that we can all understand and follow. The fact is, the 507 planning engages all of you in the process, and that's exactly what we've been missing out on. We meet regularly with different advocacy groups across all of New York State and hear from them frequently. But we know many of you aren't part of an advocacy group and often don't have the time for frequent engagement. And that's why this process and this engagement is incredibly important, and it gives everyone the chance to have their voice heard. The purpose of the 507 planning process is to determine the service system vision and goals over the next 5 years and how to achieve those goals. Within that 5-year term, there are separate annual goals that we hope to achieve. Those annual goals are updated every year, which is the reason the 507 strategic plan is expected to be updated and released every year. Everything we do and every decision we make is built around OPWDD's vision that people with developmental disabilities should be afforded the opportunity to enjoy meaningful relationships with friends, family, and others in their lives, experience personal health and growth, and live in the home of their choice and fully participate in their communities. We include this slide as an important reminder to all of us of our mutual purpose as we begin the planning process for the years 2021 through 2026. Entering this planning cycle, OPWDD has set specific goals we would like to meet as the overarching themes behind our planning. And these include sustainability, that all eligible people will receive supports that can continue to be maintained well into the future. Equity, that all eligible people will receive supports based on their specific needs as determined using a fair and consistent process all across the state. And accessibility, that all eligible people will be able to access flexible services and supports that change as a person's needs change, and that those options will be explained in the language of their choice. And we also want to ensure that we're meeting those goals while providing services in the most integrated setting possible for each person. The challenges presented by the COVID-19 public health emergency are still impacting us all. And our direct support workforce and our service providers worked hard throughout the past year to keep everyone safe. Many people were isolated from family and friends, and students with disabilities struggled to participate in remote schooling. Family caregivers struggled to meet the needs of their loved ones without their usual daily routines and support. And as we're emerging from COVID-19, there remain some very real challenges. Workforce shortages, which were already a concern prior to COVID, are even more critical. Prior to COVID, we were already experiencing significant growth in spending on many of our supports and services at rates higher than increases to annual funding. A spending increase of about 6% annually per person per year in group homes on average, while the number of people receiving services grew less than 1% each year. 5% growth annually on rehabilitation spending, with less than 1% growth per year in people receiving the service. Supported employment spending per person grew an average of over 8% annually, while the number of people using the service remained the same. Agency-sponsored respite spending grew by over 13% annually, with only a 2% growth in the number of people using the service. Self-direction spending remained the same per person. However, the number of people who participated in self-direction grew an average of nearly 36% year over year. As we enter a new post-COVID environment, we need to resolve the significant growth in spending we're already experiencing prior to the pandemic and look at ways in which we can provide support to more people more efficiently. There are opportunities despite the challenges. COVID-19 has shown us that technology can help us improve services. We have seen increases in the use of telehealth technology to help residential staff consult with medical staff about the health of residents, cutting down on unnecessary and risky emergency room visits. We have also used technology to connect people and help people continue building skills when in-person services can't happen. Cooperative programs, such as the one run by the Capital Region BOCES, are examples of how we can begin to address the workforce shortage. A new direct support professional training program at BOCES, in conjunction with the New York Alliance for Inclusion and Innovation, gives low-income people who are unemployed or underemployed training through BOCES to become direct support professionals. Capital Region BOCES has also established a 2-year program where students can learn skills with the goals of becoming direct support professionals during the final 2 years of high school. In addition, federal funding being provided under the American Rescue Plan gives us additional opportunities to address some of the challenges we face. The federal government implemented the American Rescue Plan in 2021, which sets aside funding for home and community-based services through Medicaid's Federal Medical Assistance Percentage funding, or FMAP. This is being delivered in the form of a 10% one-time rise in the federal government's share of spending on the Medicaid program starting in April 21 and extending through March 2022. The goal of the program is enhance, expand, or strengthen home and community-based services. The Rescue Plan will provide one-time short-term funding with a 3-year window for the use of the funds. We are seeking your feedback to determine how the funding can best be used to help support people. Our initial plan is due to the Centers for Medicare and Medicaid Services, CMS, in mid-June 2021. These forums are an initial opportunity to hear from you, and there will be additional opportunities after we submit the initial plan. And here's our timeline. Throughout the spring and summer, there will also be many opportunities for you to provide input into OPWDD's strategic plan. Input can be provided through the mail or through the new email address, planning@opwdd.ny.gov. These regional forums are just a starting point to the process. There will also be many sessions with organized stakeholder groups throughout the summer. Additionally, once we have a draft plan put together, there will be another organized effort to hear feedback on the plan in the fall of 2021. In the invitation we sent out to invite you to these meetings, we included several questions regarding areas we were looking for feedback. Those questions were not meant to limit you. They were meant to get the thought process started. The following slides will go into those areas a little bit further to help you understand where we are and where we need input from you moving forward to make sure your interests and concerns are taken into account. OPWDD serves people throughout their lifespan, from very young children who live at home with their families and who are primarily provided supports through their local schools receiving only minimal services through OPWDD, to older adults who need supports across every area of their life, including housing. At all stages of people's lives, we want to provide the right level of support so that people can live meaningful lives as independently as possible as we meet the ever-growing demand for new services. As people age, their needs and interests change, and the focus of services must change also. Therefore, our strategic plan must take into account the need to support families and the development of skills for children, promote independence and support meaningful activities in the community and employment for adults, and provide appropriate services for people as they age, such as increased support needs, retirement, and late life changes. Helping people to live as independently as possible while providing access to the supports they need to meet their goals is the basis for OPWDD's housing plan. Our variety of housing supports currently range from housing subsidies that give options for independent living to settings offering different levels of support and supervision, such as smaller community group homes and much larger congregate settings. OPWDD supports approximately 38,000 people in residential settings, and on average, 1,200 new people move into an OPWDD residential setting every year. The OPWDD housing subsidy is authorized for over 6,000 people statewide. A self-direction model with shared living, environmental modifications, and assistive technologies is available for people to help maintain independence. Our goal is to continue to grow these existing opportunities while also looking at how we can better support. Excuse me. Having a little technical difficulty. Okay, let's see. There is a current activity that invites people in state-operated homes who have less challenging needs to consider a new living opportunity with a voluntary provider, which would in turn create an opening in a state-operated service for people ready to leave residential schools who have more complex needs. And the 507 strategic plan will take into account these and other ideas in planning sustainable housing supports for the future. Day and pre-vocational services. The COVID-19 public health emergency has shown us that day services need to be more flexible and better meet the needs of the people we serve. While many people found teleservices to be a good alternative, it also did not work for many people as well. A few of our findings in this area for consideration as we plan for the future services are: person-centered planning must be done for each person to determine whether teleservices or in-resident supports will better meet their needs. A balanced combination of services that can support a person within their home and within the community would be the goal. Transportation can be a barrier to services and employment, so solutions must be sought. Vocational and social skills should be a component of all day services. The day habilitation structure could be more beneficial, and if it were more individualized, more focused on skills for independence, and took place in smaller groups within the community. Employment. In building the 507 plan, we also need to look at how we ensure that employment is the first option for people who want it, and how we can better prepare people for employment. To incentivize hiring, OPWDD has offered a back-to-work incentive to pay for wages for a short term under the condition that the employer agrees to hire after the time period is over. We need to look at other ways that might incentivize employers to hire people. Positions may need to be customized to offer employment opportunities for people of all abilities. To create an employment path for people to follow, all day service providers could be encouraged to offer the community pre-vocational services option so that people in day habilitation could move on to pre-vocational services or pathways to employment to gain employment skills and then on to employment. Employment staff need to be trained to not only assist the person receiving services, but also negotiate and work with businesses on hiring. Those are just a few examples of how employment programs could be improved upon moving forward. Self-direction offers the most flexibility and control over a person's services as possible. Self-direction is intended as a choice for anyone who is able to make their own decisions about their services or has chosen another trusted adult to help them. OPWDD is currently working on enhancing training and communication for support workers, fiscal intermediaries, care managers, and support staff so that people have professional help available to help them self-direct. The new 507 plan should take into account how we can improve upon these services even further. We've seen a lot of growth in the number of young children and families looking for cross-system and residential supports over the last few years. This growth shows a need to grow community-based supports to make sure that children and their families are able to get the help they need, including the ability to support those children who are in crisis so they can remain at home with their families. Future planning should take into account the need to provide adult placement services for children leaving residential schools. Telehealth became a life-saving support throughout the COVID-19 public health emergency. At this time, there's work around extending this support beyond the health emergency and making it a more permanent support. And there are ongoing talks around policy and regulation changes that might be needed. OPWDD is also looking at the use of clinical services across disability types to see where changes should be made to match need and demand. Making sure services are available to meet identified clinical needs is critical. OPWDD is also working with state and local mental health and hygiene partners to identify gaps in access to crisis supports and services and problem-solve strategies to help fill those gaps. We anticipate this being a large part of future planning. The initiative mentioned earlier, which helps people move out of more restrictive settings to less restrictive housing, is one strategy we are currently using to make space available to serve people with more complex needs and to provide choice, to ensure people are living in the most integrated settings, and to make use of current vacancies, and to open opportunities in state-operated homes for people who have aged out of residential schools and are waiting for adult service opportunities. State-operated residences can provide highly specialized services for people with complex needs. These are areas we anticipate will play a significant role in our strategic planning process. As care coordination organization, health homes have been operating for almost 3 full years now, and many of the early challenges with developing new organizations have been overcome. We now need to turn our attention to enhancing the quality of care management services. We want to evaluate the strengths and weaknesses of the health home model and helping people of all need levels to learn how we can improve going forward. We want to look at this particularly for people with complex needs and those who live outside of a congregate setting. Care management was established to improve the coordination and integration of services across multiple systems, including health, behavioral health, and developmental disability services to help people stay healthy and avoid the need for crisis and emergency health care, and to establish ongoing supports timely. Over the next several years, we want to increase the care manager's ability to serve people with complex needs and better integrate care across multiple systems to focus on the whole person and not just their developmental disability services. As the demand for services grows, so does our need to attract and retain a qualified workforce. OPWDD is partnering with providers of services and other organizations to begin building recruitment opportunities at the high school level and among non-traditional adult students. We've developed training opportunities in partnership with SUNY and are looking at additional ways to build staff retention. OPWDD is supporting the Regional Centers for Workforce Transformation to build competency, enhance training, provide technical assistance. We want to increase recruitment efforts for clinical staff to provide important and much-needed behavioral, nursing, and dental services. Innovation in technology and housing will not only increase independence for people we support, but will help us maximize our workforce during the ongoing shortage. Data collection is also part of an ongoing effort to allow for targeted workforce strategies. These and other opportunities to strengthen our workforce will be crucial to the future sustainability of the system and will play a major role in the 507 plan. Now that we've set the stage, sharing OPWDD's goals moving forward, some of the challenges we face, and some of the opportunities we have available, let's turn to these stakeholder forums. The idea is to hear from you and get your feedback on your vision for the 5-year plan and what topic areas are important to you. Your feedback will guide us as we begin drafting the 5-year plan next month. We will follow these 5 public forums that we're hosting with attendance at meetings arranged by different advocacy groups where we will also get their feedback on the 5-year plan. Our regular public meetings with groups like the Developmental Disabilities Advisory Council and the Family Support Services Planning Council and by meeting with numerous other representative organizations. Overall, we have about 30 additional opportunities to hear from others who were not able to attend these forums. If you have not already, I invite you to check out our strategic planning page on the OPWDD website. You can get there by looking under About Us in the footer. You will find information related to the planning process, current initiatives, and links to the data. This page will be updated throughout the planning process as new information is available. And with that, I'm going to turn it over to Karen so that we can start hearing from the people who've signed up to speak at this forum. Thank you.
Thank you so much, Delia. Okay. And we are now at that part of the program where you all do the talking. I'm going to read your names off one by one. As I read your name, please unmute your microphone so that we can hear you and begin speaking. You will have 3 minutes. To help keep us on time and allow for all speakers to share their remarks, you will see a 3-minute timer on the screen. As a reminder, if you haven't already, you may share your written remarks with your regional contact, and your full remarks will be considered. And with that, we'll move to our first speaker. ELLIE Ruffer?
Roofer.
If you can, Ruffer, my apologies.
No, that's quite all right.
Thank you. Thank you. You may begin.
Thank you. Okay. I'm going. Can you hear me?
Yes.
Can you hear me? Okay, thank you.
Yes, we can. Thank you.
Thank you, Dr. Kastner and Delia. Okay, can I go? Thank you, Dr. Kastner and Delia and OPW for the opportunity to speak tonight. I'm ELLIE Ruffer. I'm Katie's mom and an advocate for all people with intellectual and developmental disabilities. I'm here today to offer my personal ideas about what should be in the strategic plan that OPWDD is obligated to provide under the 507 mental hygiene law. A reality check is a great place to start. Fact, there aren't sufficient workers or enough money to adequately support people with IDD now, and certainly not in the future. Using the FMAP money is an opportunity to start moving staff towards a living wage. Stop asserting that OPWDD has been getting budget increases annually that cover needs when expenses and the number of people increase.
Frozen again.
So effectively, it's an annual cut in per capita spending. Gather data and plan for reality. More people will be asking for more services. Be fully transparent about how the data will be used. Update computer systems so that data collection can happen easily and accurately. Treat all people with IDD with the same thoughtfulness and respect that you treat your own family. Everyone deserves the opportunity to go after and experience a realistic version of their dreams. Sadly, no one gets a better life because they simply want it. In the case of people with IDD, making dreams a reality is noble and only possible if those aspirations have a basis in reality. My daughter will never be a princess, no matter what she wants. At the same time, a realistic goal of being safe and having a chance at happiness is only achievable if there are enough staff to protect her and help her achieve. That is the reality of life for people with IDD, no matter where they live or how they access their services. Plan for all eventualities based on data. Plan adequately for new people with data from the DOE. Plan adequately for an aging population. Offer a full menu of services based on health, safety, and personal choice. Do not push least expensive options if they are not the right choice for the person. Early in my advocacy experience for adults with IDD, a well-known self-advocate said to me, you cannot speak for your daughter. My response was, true, but neither can you. There are those who say large homes are bad. Largest occupancy should be 4. Why? No one else has limits on housing choice. daughter likes the social life that her large group home offers. I believe that proclamations made by people seeking to reinvent the delivery system that is in place to improve the quality of life for people with IDD are essentially discriminatory at their core. They dismiss choices already made as bad and proposals offered as the answer to all issues. As a child of the 60s, I realized that looking for nirvana is most often an exercise in futility. Get real. It's an inconvenient truth that our family members, through no fault of their own, need supports. Some a lot, some just a few. We can't finesse it, we can't wish it away, and we can't ignore it.
Thank you. I'm just going to jump in and make sure. Did you send your full remarks through?
Not yet. No.
Okay.
I will.
Thank you. Wonderful. Thank you so much, and thank you for starting this out this evening.
Happy to.
Thank you. And thank you. And we will move to our next speaker, Jim Carp.
Hi, Jim Carp here. I'm waiting for the clock.
Good evening.
Hi, I'm Jim Carp. I'm the father of 2 young adults with intellectual and developmental disabilities. And I hope I'll be forgiven for shamelessly plagiarizing, because I have a dream. I have a dream that in New York State, people with IDD live lives of dignity, purpose, and choice. And I have a dream that the people who care for them also live lives of dignity, purpose, and choice. There's practical steps that we can take for those dreams to come true. We have to have adequate funding, we need increased accountability, and we need increased flexibility. Plenty of people are going to talk to you about the funding today, so I'm going to skip right to the increased flexibility. Because we don't just need money, we need to be allowed to spend that money in ways that help people. I've spoken with many provider personnel, from CEOs down to the DSPs, and there's widespread frustration with the gap between 2 things. On the one hand, there's what the people need, and on the other hand, there's billable events. Other states have asked for and been granted more flexibility. For example, CMS has approved a daily rate for overnight support of people who are living in uncertified settings. This has happened in other states, not in New York. And this creates tremendous flexibility, and it's let loose a flood of creativity and innovation. There's many other examples of flexibility that we could ask for and be granted. Further, to achieve quality, we need accountability. We need to see what's happening, and we need to be able to take action. So to see what's going on, we need data, and many other people will talk to you about that today. We need a clear-cut appeals process for any decision, so that there's a way to enforce the flexibility. And we need an independent oversight organization that is adequately funded and that's authorized to help people. So there's 3 areas where we need to work to make my dream come true. We need adequate funding, increased flexibility, and increased accountability. Now, I know that not every dream comes true, but many do. And I hope that New York State will dream big and will strive mightily to make that dream come true. Thank you.
Thank you very much. And our next speaker is Mary Krasner.
Yes.
Good evening.
Hi. Should I wait for the clock?
Oh, go right ahead.
My name is
you.
Mary Krasner. I'm the parent of a young man with multiple disabilities and medical issues. It's very clear that the staffing crisis is not addressed this minute, then all the plans in the world will not matter. Luckily, the new FMAP bump gives New York State a chance to do something now, only a finger in the dike, but it does buy time to fix the underlying problem of wages that are not commensurate with the jobs. 507 plan must lay out ways to be sure that staff receive a living wage. How can a plan have any meaning without information about who's out there, who's waiting for services, whose needs are changing for better or worse, and who will be knocking on OPW's door as they graduate in the next 5 years? I'm part of a volunteer guardianship committee, and we are searching for placement for 2 individuals whose residences are being shut, putting all the residents in need of a new home. Closing residential beds must not happen and must not be part of the plan, given the present need and a long waiting list. We have responsibility for 3 more people who, because they are aging, now require residents that can handle PEG tubes. That's happening now, a sign that there must be a plan for those who will need more support as they age, to know who they are and where they are. Again, data. OPW should support employment, but must also have programs for those for whom it is not appropriate. Flexibility in day services sounds totally reasonable, but not if it means leaving people in their homes for all their services. It turns homes into institutions. Alternate residential settings are a good idea, but if the money is not there for rent and maintenance, it doesn't happen. Family care is an anathema to those of us who worry about the motivation of people who sign up to do this. Not that there aren't some with pure hearts, but there aren't enough of them to make it a reasonable alternative. The legislature put the COLA back in the budget to help stabilize providers in financial peril, but OPW cut reimbursement when someone isn't their home, whether they're visiting family or have been hospitalized. CMS might have approved this, but that doesn't mean it has to be done given the damage it's inflicting. Equity and access are just words given the torture going through the front door, and I don't use that word lightly, especially for those for whom the bureaucracy is daunting, who are busy or don't speak English as a first language. There is a lag that causes some families to stop trying. The plan should include ways of making it easier to navigate. Knowing who is there, who is coming, what their needs are and will be, laying out a broad range of choices for the broad range of capacity is ambitious, but the only thing that will make a 507 plan any use at all. Thank you.
Thank you very much. And the next speaker is Alice Shulman. Alice, if you can unmute your line, please.
I had some trouble. Should I wait for the clock?
There you go. Thank you so much.
Thank you. Thank you for allowing me the opportunity to speak to you and for my child who cannot speak for themselves. I am the parent and guardian of a 23-year-old with severe autism and IDD. They are enrolled in Selfdirection. In Selfdirection, an individual has a budget funded by state and federal monies. A broker helps create it, a care manager signs off on it, a fiscal intermediary approves and checks documentation of all expenditures, and lastly, Albany oversees it all. There are at least 4 sets of eyes on all the spending. There are also rate caps and total caps on the budget lines. It is in the interest of both the individual and New York State for this program to go well. We on the ground commonly use these budgets to patch up the holes where services are stretched or non-existent. This saves New York State money and supports the individual. But the caps bottleneck the best use of the budget, ensuring a shortfall in some categories, classes, and unspent money in others. The caps are the same for upstate and downstate New York, despite the obvious difference in cost of living. We use Selfdirection because we have to. We cannot find a center with an appropriate staff ratio. Many places are not prepared or interested in serving people with severe autism and IDD. The 1-to-1 ratio my child needs is too expensive. So we use the IDGS budget to create classes for our child. But individual directed goods and services, it's capped at 32,000, and from the name, it's clear this is designated to fund more than classes. Even transportation to IDGS classes are charged against IDGS. I see I don't have much, so I'm going to rush to the end. Self-direction did not always have these caps. Now I can only hire a BCBA who charges $61 an hour. In New York City, BCBAs typically charge $200 an hour. I would like to hire someone to help develop a staff action plan and support my child reaching targeted goals and train staff to help this progress, but I can't. I assume the restrictions are designed to prevent fraud. Remember, we've got those 4 sets of eyes anyway. Please allow our communities and our families true person-centered planning. Keep the money supervision, but flip out these caps. Give us the ability to address needs and priorities and give us a louder voice. Thank you.
Thank you. Okay, thank you for that. And we'll move to Ben Fang.
Yes. Hi, everybody. My name is Bing Fen. I'm a father with a child with autism, and we know we have lots of problems we can talk. But here, I just want talking about the experience, which is helping my son to get the employment. And we know that in January, about 80% of the young autistic young people and adults, they do not have working experience, became unemployment. People can do whatever they work, and they're very happy, and they can become very good employee on their position. The issue is that we need to help them. We need to find out the right help. So from my experience, I'm helping my son in the last 3 years. I found out that no matter OPWDD or DOE, we need to do a lot of things more to promote, to help them to find out the right career, to find out the right position, and to find out the right people to do that. Because to get employed is probably one of the best way to get independent. Okay, through that period, he learned lots of things. He learned how to independent travel. He learned how to independent to manage his time. He learned how to independently working by himself. So I really wish that in the next 5-year plan, we get more focus on there. Particular, I want to OPWDD have more chance working with the DOE. We should have put the employment period before they graduate. Okay, we should have the starting as the transition plan, starting from maybe middle school. We should have put the employment as a target, so we can help the young children and their family find out what kind of job their children capable to do that. Okay, then we should have lots of training. We should give them lots of pre-vocational training, even before they graduate, even before they reach 18 or reach 21. Okay, because they need to learn lots of soft skill before they're able to do any job in the professional environment. Okay, I also want that we have a more day rehab program, which is also have capable to give them the training for the different job explorations, like the pathway to the employment. And you know, this is everybody right now talking about we have a shortage in the workforce. But think about about half of a billion people over the after the school it's autistic, and 80% of them unemployed. This is really a waste of the life and the waste of the very, very great source. And we give them the right help and the position. They can become excellent work, and they can be independent, and they will be very proud of themselves. So thank you for giving me the opportunity.
Thank you very much. And we'll move to Linda Blumpkin.
I'm the mother of a 31-year-old young woman with Cornelia de Lange syndrome, autism, and intellectual disability. I'll submit my prepared remarks in writing, but I'd like to take this opportunity to react to what I consider truly shocking comments by Ms. Tucker about what appears to be OPWDD's plan now to return to institutionalization and move away from the privatization that were the major initiatives of OPWDD in recent years and indeed decades. The concept of moving people in state ops settings with less complex needs to the care of private providers and to replace them with those with more complex needs is obviously OPWDD's attempt to accomplish two goals. One, to reduce the cost of care of individuals throughout the system by moving people down to less expensive settings, and the private providers that you're contemplating may well be the family care settings that I believe Mary spoke about with such fear and concern. And then on the other hand, to take the folks with the most complex needs and move them where? To Sunmount, the developmental center in the Adirondacks, where their family members will never be able to see them, or maybe to something like the metro area state ops, which have been on OPWDD's own early alert list since 2015, where OPWD state ops are one of the least competent, least qualified providers in the state of New York, where you've been repeatedly cited and have failed to cure citations for failure to comply with community inclusion, medical follow-up, medication administration, protective oversight, habilitative services, physical plant, staff training, and incident management since 2015. And these letters with these violations run from an OPWDD bureaucrat at one desk to his or her colleague at the next desk, saying you're being cited for this and tell us about your plans for curing this, and we'd like to work with you to make this right. Since 2015 on your early alert list, and the only reason the Brooklyn Developmental Center got off your early alert list where it was for years, because it was shut down and people were either moved into OPWDD run group homes in the community, or God forbid, sent up to Sunmount or to at the other developmental center that you have for a largely criminal population. Shame on OPWDD. Shame on you. This is one of the worst things I have ever heard from OPWDD in my decades of hearing truly terrible things from you. This is a return to institutionalization and to a dumbing down and a diminution in the quality of care. Shame, shame on you.
Okay. Thank you. And we will move to the next speaker is Bunny Rivera.
Yes, hello. Hello?
Hi.
Hi, okay, you can hear me?
Yes, we can. Thank you very much.
Great, thank you. My name is Bunny Rivera, and I'm a mother to my son Chaz Rivera, and I am a self-direction parent. I want to say, first of all, the saddest words in the English language are, it's always been done this way. I think there's a lot of areas of improvement in self-direction, and I'm going to focus on 3 because there are many. The first one is self-direction brokers. It's increasingly difficult, if not impossible, to find a broker. They have to be in your area and they have to be connected to the FI. I'm a parent advocate. I run a very large private support group here in New York City called Mountains of Mothers. I hear all day long that families cannot find a broker, and when they do, they either can't contact them or they don't last very long. And I myself have been through 4 in the last 2 years. I'd like to propose that it would be easier for a parent to become their own broker, and that the trainings become easier to access and ongoing throughout the year. Understanding that there are many rules and regulations that need to be followed with updates, I suggest that if a parent wants to become their own broker, that they do so for their own case, going through a streamlined process for their family only. This should be an option for all families. A waiver can be signed that it's for their case only if that's needed. There's ways around it. It could be an unpaid position, but it would help many families who cannot find brokers and get lost in the system and who really, really need it. And it would also save money for OPWDD if they're unpaid, so it's a win-win. 2, the biggest issue in self-direction I've had in this category are the budget caps, and I think Alice mentioned this. I've been trying to find out why and how categories are capped. I still don't have an answer. For example, if I have money in community habilitation, but I need to divert that to another category like IDGS for classes, as Alice said, I don't understand why that cannot be done, only that it can't be done. If the funds are coming out of the same budget, meaning the overall state budget, I do not understand why there is no flexibility. What happens to the funds that are unused, like my ComHab funds? Where do they go? If you really are putting people first, then families should be able to decide where those funds are needed as long as they come from the same budget source. It's common sense and it's business sense. The inflexibility of these category caps, for which there is no explanation or transparency, was devastating to my family this year during COVID and caused my son to fall into a deep depression and when his IDGS classes were cut off. This should not be allowed, especially since we are trying to help these kids. It is the families on the front line. Lastly, family reimbursement respite budget cap is extremely low. This is another issue of being the same deal with not being able to utilize the funds the best way that the family needs the help. This is another example, again, of no flexibility, and I would like there to be more transparency on how these caps were developed and why they were developed. Thank you.
Thank you. And the next speaker is Cindy Godoy.
Thank you.
Thank you.
I wanted to thank you for the opportunity to speak today and understand what an undertaking this is. And I hope that the words spoken here today and throughout your talks are received and bring about some new approaches, creativity, and thinking out of the box. Some of the hats I wear include self-direction parent, self-direction broker, and advocate. And I say this just to give you a small picture of where my perspective comes from. I've learned so much, and yet I know so little. In the interest of time, I'm just going to touch on a few points, although I know that there is so much more. One is I think all would benefit from more collaboration and oversight. As a broker, I always remind families that we are a team working on behalf of an individual. This mindset should also be one amongst the organizations in place to support individuals, specifically between OPWDD, CCOs, FIs, and the DDROs. FIs should not be allowed free rein to arbitrarily make rules around what they require and what they will choose to cover. CCOs should have frequent training for supervisors and care managers around supporting individuals and the process by which to do that. In addition, rules and regulations and timelines vary greatly amongst DDROs. They should have the same processes across the board. For example, applying for self-direction differs between DDROs. I think this will also help with having a clear timeline that provides clarity to families around the process of receiving services. Another agency I think OPWDD needs to begin to collaborate with is the DOE. I think the results of this will be twofold. Many families do not even know the existence of OPWDD, which is astounding to me. And introducing it early on in the IEP and transition process to families would be a good way to keep families informed of services. In addition, this is necessary for individuals to begin to do exactly what OPWDD aims to do, support individuals to gain independence. In order for these skills to be learned, we must have individuals begin the process earlier. I think this is more apparent when reviewing your numbers and seeing the over 5 million jump in individuals being serviced after the age of 20. The 0 to 20 age is super precious when children are learning skills and tools. In addition, the DDROs should have frequent training for their own employees around customer service and professionalism. Not every DDRO is created equally. There needs to be more staff, so wait periods are not months on end for families. Data also shows that only 37% of females receiving services versus 63% of males. This is a problem that needs additional focus, especially because we know that females are underdiagnosed, misdiagnosed, and sometimes not diagnosed at all. Another issue of disparity is the fact that 61% of participants are white, and all ethnicities combined don't make up half of that. This is a problem. Outreach is necessary in addition to language barriers being an issue. And I just want to sum it up by saying that New York has always offered a plethora of expensive resources, and for this I am very grateful. New York is a leader in the arena of services offered to individuals with disabilities, and I hope we continue to lead from this place because there is still a lot of work to do. Thank you.
Thank you. Okay, thank you. And we will move to Margaret Puddington. Margaret?
I'm the chair of the Statewide Family Support Services Committee, and I'm going to present an abbreviated version of the recommendations of that committee. 1, the growing demand for services. Increase funding for OPWDD services. With a flat amount of funding, it is not possible to meet the needs of everyone OPW is mandated to serve, including new people entering the system yearly. Depriving some people in order to serve others is not an acceptable solution. Increase family support services. At a time when OPW is downsizing residential opportunities despite a huge residential waiting list, families have slim to hope of securing needed residential placements. Families who are aging or dealing with complex medical or behavioral issues desperately need supports to survive. 2, the workforce. Workforce shortage has become a nightmare with a 25% vacancy rate, and with Walmart offering $20 an hour, DSP salaries must be increased beyond the minimum wage to reflect the high-level competencies and responsibilities entailed. Otherwise, no DSPs, no services. 3, equity of access. Provide an appropriate level of funding for people with complex medical and/or behavioral needs. People with complex disabilities are typically excluded from many FSS programs because funding is inadequate to their needs. 4, partnership with families. Spending decisions for FSS programs, increases, reductions, or reallocations must be made in collaboration with the local FSS advisory councils, which are uniquely qualified to make spending decisions based on local needs. Collect and share with families data on utilization of FSS services. Data should guide funding decisions. Personal choice and flexibility of services. In future, maintain both virtual and in-person program options to meet individual preferences. Maintain some FSS-funded service coordination services, in addition to waiver-funded CCO case management, to assist families who are not eligible for waiver and families who desire only non-waiver services. Encourage care coordination organizations to develop expertise in specialty areas such as mental health, substance use, and behavioral needs. Expedite central office review of self-direction budgets, which is currently causing extensive delays. Develop consistent guidance for family reimbursement programs regarding which items are and are not reimbursable. develop guidance for self-directing individuals outlining which family support funded services may and may not be accessed. The future of family support services. Share with families OPW's thinking on the future of managed care. Families are concerned about their future access to services. Thank you.
Thank you. And the next speaker is Rochelle Kivanoski.
Good evening, everyone, and I want to thank you for this opportunity to address the future of our system. My name is Rochelle Kivanoski, and my son has been receiving OPWDD services for over 30 years. I am also a parent advocate and have been actively engaged in the battle for quality services for people with IDD. I agree that it is of critical importance to address our workforce crisis, which is the backbone of service delivery for our family members. My son still hasn't been able to return to his day program due to lack of staff. And certainly it is imperative that there be transparency in the data being used for planning. One example is Ms. Tucker's rather perplexing assertion that cost per person for residential, day services, employment, and respite services are rising. Since not-for-profit providers' reimbursements have essentially not risen at all, what are the factors driving this increase? Data are only helpful when analyzed. I believe that any strategic plan must address how we arrived at this point of crisis for our system. To me, the answer is the persistent and egregious underfunding of services for people with IDD. Without adequate funding, all our beautiful plans are nothing but fantasies. Over the last 6 years, OPWDD has failed to allocate $442 million in approved budgetary funding for the nonprofit sector. This is nothing but negligence when our needs are so great. For example, DSPs working in the nonprofit sector earn substantially less than those work in OPWDD-run programs. Low wages are clearly one of the key factors driving the inability to recruit DSPs. Why weren't these funds authorized for wage increases for the DSPs who work for nonprofit providers? Pay parity is not only just, it is essential for workforce stabilization. OPWDD is promoting the strategy that people should reside in the least restrictive setting, which is a goal all of us would agree with. The current ISS rent subsidy is woefully inadequate, especially for those who lack family financial support to compensate for the inevitable rent and utility shortfalls. Why wasn't money allocated to increase the ISS subsidy to make independent living a real possibility? OMH increased their rent subsidy, yet OPWDD has not. Why is OPWDD implementing further cuts to residential providers in the wake of the devastating COVID pandemic, given that providers had enormous unreimbursed expenses and residents are even more in need of therapeutic leave time with their families until their lives normalize? The only answer I can come up with is that the state does not value the lives of people with IDD. The governor chose to move unspent budgeted IDD monies into the general fund that is totally under his control. We have become the executive's piggy bank. The OPWDD 507 plan must include a commitment from the state that all funds generated from federal Medicaid matching for IDD services must now and in the future be used to fund services for people with IDD. And OPWDD administration must also commit that no additional money that was budgeted for IDD services will be left on the table and lost. Then we can talk about a sustainable strategic plan. Thank you.
Thank you. And the next speaker is David Glick.
Hi, I am the parent of three children with disabilities who receive services through OPWDD. My oldest son, an adult, has cerebral palsy. I adopted him through the foster care system a couple of decades ago. Later, after I got married, my wife and I had a child with Rett syndrome, a devastating neurological disease, and then another child with a rare genetic disorder, CHD8, that causes autism, among other problems. Neither of these conditions were inherited. It wasn't expected, as it isn't for any parent who has a child with disabilities. We also have 2 neurotypical children. While I knew what I was getting into when I adopted my son with CP, I most certainly did not plan on having 2 more children with disabilities. It is life-ending, so to speak. The career I had and the advancements I had hoped to make in that career are now gone. The needs of our children are so specific and challenging that I would never be able to leave them solely to someone else's care. So even for those times when we are fortunate enough to have, say, a ComHab worker, one of us is still here and needs to be here in case there is a seizure or a swallowing or a choking problem or a panic attack or any number of other things that can happen that would need our expertise. I'm not paid for this work. I don't earn a penny, even though it is a full-time job. I have a master's degree from Columbia University, and I am not earning a penny. This places a financial burden on my family that will be long-lasting. There will be less saved for retirement, less money put aside to help care for our disabled children when we are gone, less money to be able to help our non-disabled children get a better start in life. Many states now allow the parents of adults with disabilities to be paid for their home health work. In New York State, I believe this falls under CDPAP. However, New York State does not allow the parents of disabled minors to be paid for their work, even though about 1/3 of all states in the country now do allow the parents of minor disabled children to be paid as caregivers for their minor children. This includes decidedly not liberal states such as Kentucky. I'm sorry, but if Kentucky can do it and we still aren't, something's wrong. At the rate that home health workers are paid in New York State, we are never going to be able to find someone experienced enough, dedicated enough, or skilled enough to take care of our children. However, that person already exists. It is me. And I deserve to get paid something for the never-endingly hard work that I do, even if it is only $15 an hour. Will it make a large difference? No. It would be far from what I should or could be making. But it is something. It recognizes that I and the hundreds, perhaps thousands of other parents doing the same work in this state, it recognizes that, yes, we deserve to be honored for the work we do. It recognizes that we shouldn't be relegated to a lifetime of unpaid labor. It recognizes that we exist and that our needs matter too. Thank you.
Thank you. And we'll move to Bernarda Rivera.
Hi, everyone. I am a self-advocate, and I'm here today to let everyone know about DSP's reform. It is time that OPWDD does not help us get the needs that we want as individuals living in ISS apartments. They are not founded to give us more help that we should. I am a person with a special need, and I do deserve more help in some other things than sitting at home, not going to a program that is designed for me. It is time that OPWDD and the governor should help us design a program that is specialized for us as people with disabilities. We are needed a lot of help in our home, such as learning how to read a little bit more, learning how to go out in the community and have access to other surroundings that will help us in workforce. If OPWDD, please, will help us get the money that they deserve to get more staffing in our homes and in our programs, it will be better off, that we will be happy, productive, and a better quality life that we deserve. We are trying our best to make it out there, but without the services, we don't get them anymore. So please, if you can, just please go out there and help us with some of the challenges that we face as self-advocates who are struggling out there to get more services that are accurate of help that we can give. It is time that OPWDD listen to what we have to say and not you guys putting us in a back burner and making us feel like we're back in Willowbrook. Thank you.
Thank you very much. And we'll move to Deborah Greif.
Hey, hi. My name is Deborah Greif. I'm the chairperson of the Brooklyn Family Sports Service Advisory Council in Brooklyn. I'm also a proud parent of my son, Christopher. What I like from OPWDD is that when all the information, what you're hearing, we may not like what we're hearing, but we need to understand why it's being said. We need to be educated more on what type of services you offer. One agency will tell me that a respite worker does one thing, another agency says another thing. I would like more consistency and know what each position is for. That makes it also easier when I see a shortage. Now, I know what a direct care professional does, but there are other jobs, and unfortunately, we're not, the way you describe it to not just us family, but to the government, elected officials, they get mixed up of what kind of funding are we supposed to do? What are they certified for? Now, if our workers were certified correctly, then they would be entitled to a lot more funds, and OPW could pay them correctly. I also would like to see more consistency with the reimbursement program for family support, because one region may do one thing and another does another thing. We need to have full consistency. We also need to have more updated what is allowed. Right now, you have many individuals who need to use computers because one form of a developmental delay is their eyes and muscles and the nerves in their eyes don't track, so they cannot read and write correctly, and that limits them. But yet, you will not, the individuals living at home will not get reimbursed at all. Even if an OT, PT, and a doctor, medical MD says it's needed, it's not acknowledged. I also would like you to understand that when you want people to go to work, a lot of people don't realize that our children are called disabled adult children. What does that mean? They're qualified to collect under their parent's Social Security when their parent either becomes disabled, retires, or passes away. It is extremely important that we advocate that Social Security raises the income level of what the parent made and what the individuals can make, so they do not lose their medical coverage. Because if a child makes $1 more than mother or father, whether they collect under, they lose their Medicaid, and if they have to pay for the waiver, it can be more than $500 to $600 a month, taking up the whole paycheck. That does not make sense. That is why, as much as parents and everyone want our individuals to go to work, it doesn't make sense if all the money is going to just go to one thing, medical care. The rest of my statements I will be putting in writing. Thank you.
Thank you very much. And we'll move to Millington.
It's Millie.
I'm sorry.
Correct pronunciation. Hello everybody. Good evening. Thank you for allowing me to speak tonight. As I said to Heather in my message, so I'm currently a graduate student at the CUNY Graduate School of Journalism, and as a disabled person myself, I'm working on a long-term multimedia project for graduate school, and it's about people with disabilities in New York City and their challenges with work, both before and during the pandemic. And I'm specifically focusing on challenges regarding being able to find and get and keep a job, and also transportation and remote work for disabled people. And I would just like to know, for those that are interested, those that are here that are interested, if you would like to, contribute, you can send me an email, or I will put my email in the chat so that you can try to put my email in the chat so that you can reach out to me if you are willing to share. Um,
And that's something that your regional contact may also be able to help with?
oh, yeah, maybe. I reached out to Heather Ethel Hines. And she was the person I sent it to. So,
okay.
If yeah, I'm not sure if the chat is active, but
No, I don't believe it is. No.
okay, but yeah, if you could Karen, if you could just let her know that you know that I'm interested in speaking with some people who have attended this event who may be interested in sharing their stories for my project. That would be great.
Okay, we can do that. Yes.
Okay, great. Thank you. Is there an email address that I should forward it to?
We have your email address. It might be easier just for us to reach out to you.
Okay, great. Got it.
Okay.
Thanks.
Wonderful. Thank you. Thank you. Okay. Excellent. And our next speaker is Diane Jones.
Good evening, everyone. My name is Diane Jones. I have been an advocate for my son, William Harrison, for going on 38 years now. And my main focus is we all have dreams and goals for our loved ones, okay? To focus on their community, their lifestyle, their living arrangement, their capability to have some kind of function in the community, you know, to be able to function just as we function. And that's what I think that we want for all of our loved ones. Okay. My main objective, main goal is getting parents to be associated more with their loved ones and in their planning, whether they're guardian or they're just the parent of that loved one. But I believe that maybe there should be some kind of form of, we have parents, teachers association in school, in OTC. We can develop one of those, you know, where we can get parents together, get them to, because you never know what somebody else is going to know that you might not know, you know, and that might help somebody else. This is the whole thing. We need to involve and evolve ourselves in our child's lives, okay? We need to inspire them as far as jobs are concerned. We have a lot of people that are not working, that are just sitting at home, not doing anything. They're going to waste, and that's not good. We need community-based for non-work services, access to community activities. We need to help with their vision, their long-term. We need diverse and cultural activities. All right. We need to raise awareness for what is going on around the world and what is going on in the world. So this way they will know and have the opportunity to deal with it. Thank you for the opportunity to speak.
Thank you very much. And the next speaker is Mary Ann Verga. Marianne, if you can unmute. We're having difficulty hearing.
Can you hear me now?
Yes, we can.
Okay. All right. My name is Marianne Verga. I am co-chair of the Staten Island DDSO's Family Support Services Advisory Committee. I encounter a recurring theme when trying to get services for our 23-year-old son who has severe spastic quadriplegic cerebral palsy. He's nonverbal, non-ambulatory, diapered, needs feeding and assistance with all the ADLs, but is otherwise a very bright, fun, and engaging individual with feelings and a lot to contribute to the world. We are often turned away by OPWDD funded agencies and services because they say they are not yet wheelchair accessible or do not have facilities to change him, but mostly because they cannot provide the one-to-one staffing that he requires. OPWDD must increase their funding to agencies to enable them to use their service, to enable people like my son to use the services they are legally entitled and mandated to provide. Public tax dollars are allocated to be used by all disabled people, not just those who have less support needs. OPWDD must provide incentives to agencies to ensure that those with more complex disabilities are included on all levels of services: housing, day hab, community hab, job training, and respite services. Those that need the services most urgently are too often the ones turned away the most often. It's bad enough that the world at large discriminates against them, but to have it occur regularly within the disabled world is simply deplorable. It's a shame that he and others who are like him are constantly overlooked, not because agencies don't want to serve him, but just because he has more expensive needs. Thank you.
Thank you. Okay, and we'll move to Golston Lyon.
Yes, you can hear me?
Yes, we can. Thank you.
I'm responding to the following 507 planning question from OPWDD. What research projects would assist in screening, evaluating, identifying, and supporting people with developmental disabilities? I would like to disclose first that I'm currently employed as a physician scientist at the Institute for Basic Research in Developmental Disabilities, also known as IBR, in Staten Island, New York. However, I am testifying today as a private citizen and as a member of the Council on IBR Planning. In 1958, the New York State Legislature authorized the creation of IBR. Over the past 60 years, IBR has conducted groundbreaking research on developmental disabilities, and IBR is ideally suited to continue making discoveries as the main research institute within OPWDD. IBR can be involved in helping to analyze the amazing advances in genome sequencing that have occurred over the past 10 years, and IBR could help to transform the OPWDD system by working to obtain a genetic diagnosis for about 1/3 of the 130,000 or more clients of OPWDD. This would help the families to understand why their loved one has a developmental disability, and this could open the door to early intervention efforts and possibly even genomic cures, given that the fields of gene therapy and genome editing are making truly remarkable progress right now. Genetic testing for the entire OPWDD population can be achieved through a concerted effort involving genome sequencing, which could be funded through the annual appropriation for IBR and possibly also with the use of one-time FMAP funds. If one looks at the budget appropriations in the governor's office, one can see that the total amount appropriated for research and developmental disabilities within OPWDD is $29 million annually. Unfortunately, every year, the governor's budget office in Albany rejects not only spending most of that appropriation on research, but also rejects the hiring of most new people to replace people that are retiring at IBR, so that the annual amount of money spent on IBR keeps decreasing, although the appropriation amount remains the same. It seems to me that IBR, or even OPWD for that matter, is not being allowed to spend or control their annual appropriation, despite this being legislatively mandated. And it seems that this appropriated money is being used for other things by the governor and the budget director, as this money seems to get swept into the common fund and is not used for anything related to developmental disabilities. This was also pointed out tonight on this call by Rochelle Kovanovsky. It is also vitally important to hire new clinicians to replace those who have retired from the Jervis Clinic at IBR, so that diagnostic evaluations and genetic testing can continue and increase at this tertiary level diagnostic clinic, so that OPWDD can understand the genetic basis for why some of its clients have developmental disabilities, possibly leading to better preventive medicine such as seizure prophylaxis and possibly future genomic cures. IBR also does not have a current director, and we only had an administrative director for the past 4 years, so there's an urgent need for the agency to appoint a scientific and medical director for IBR. I hope very much that OPWDD will consider the ongoing research at IBR as part of its 507 planning. Thank you very much.
Thank you. And the next speaker is Jennifer Teich.
Can you hear me?
Yes, we can. Go right ahead.
Having camera issues.
Oh,
okay.
We can hear you though.
Okay, great. Thank you for giving me the opportunity to speak to you tonight about housing. OPWDD, I am the Associate Vice President of Individualized Supports at AHRC New York City. OPWDD has a variety of housing options for people with IDD that have totally improved the lives of many people. However, there still remains a large number of people who are in need of stable housing. One of the ways that OPWDD can expand its housing footprint in a low-cost way is to remove the barriers to non-certified housing. OPWDD has a housing subsidy that is available either through self-direction or as an add-on service. However, the funding and regulations around the housing subsidy make it very difficult to support these types of living arrangements for people and their provider agencies. One of the biggest funding issues is that the payment standards are too low. This forces vulnerable people to live in vulnerable neighborhoods, which not only puts the person at risk, but also makes it very difficult to find staff willing to travel to these neighborhoods. The subsidy should be aligned with the HUD Fair Market Rent-Based Housing Voucher Program. HUD's fair market rents are set at approximately 40% of the area's typical rents. This is not a huge increase, but would provide people the opportunity to live in safer neighborhoods. It also allows people to stay in their housing longer, as their rent increases every year and the housing subsidy has not increased since 2012. Another funding issue is the maintenance of both property and personal belongings. Certified residences receive funding for capital development, acquisition, maintenance, etc., and then are subsidized for staffing, administration, transportation, vehicles. Non-certified housing does not have access to any of those funds. If something breaks or needs replacing, it's at the expense of the tenant, who is more than likely to be very low income. Another funding issue is that there's startup funding for non-certified housing, either $3,000 or $5,000 for someone moving out of a certified setting. This funding is a reimbursable expense. The only way to access these funds for people is through credit, which is very expensive, or to get support from a family member or an agency. OPWDD should create a cash flow for people who do not have access to resources or savings, either through banks or through upfronting those funds to ISS agencies or fiscal intermediaries. The regulatory barriers to the housing subsidy start with how the housing subsidy is approved and how it flows to the person. OPWDD provides a conditional approval for people who are not self-directing. And once a living situation is identified, the lease is signed, then the paperwork goes to the local DDRO and eventually central office to issue a price sheet for billing. This process can take months, and in my case, sometimes even past a year historically. The renter is then responsible for paying their full rent for that time period, which many people cannot do without assistance from either family or an agency again. Additionally, unlike other housing subsidies, OPWDD does not provide any documentation to ensure a landlord that the person is approved for the subsidy or an amount. Many landlords turn folks away without this upfront documentation. Lastly, the oversight of the subsidy on FIs and ISS agencies is very large. Doing an annual in-person checklist, participation agreement, now income verification and recertification is a very time-consuming process. For ISS agencies, the admin fee is only 10% of the housing subsidy. For FI level 1, billing is only $125 a month. For level 3, the funding is higher, but this inequitable administration prevents or dissuades ISS agencies and level 1 FIs from supporting individualized housing. In summary, there's a chronic shortage of housing for people with IDD in New York. The housing subsidy could alleviate a portion of that shortage by reviewing and renewing the funding mechanisms and regulations at a very low cost compared to certified settings. Amending these issues would create incentive for provider agencies and FIs to support non-certified housing situations in a more robust fashion. Thank you.
Thank you. And we'll move to Karen Bryant.
Hi, how are you?
Well, thank you.
I'd just like to thank you for the opportunity to speak with you tonight. My name is Karen Bryant, and I am the Director of Fiscal Intermediary Services at Children at Play on Staten Island. I have been working in this field for 10 years. I began as a DSP and eventually found my home as a fiscal intermediary back in 2016. I got into this field because I have a younger sister. She is 27 years old and she has IDD. I am very involved in my sister's life, and I advocate for her and her needs in any program that she's part of. She started Selfdirection back in 2015 once I discovered the service and began to look into it. So I will say I'm a huge advocate for Selfdirection, because I can see how it would help individuals when used appropriately. I also feel that I am lucky to have a perspective from both sides as I deliver the services, and also I'm an advocate for the services. So I am here to advocate for other fiscal intermediaries. Currently, the biggest roadblock that we are having is the state funding. The state funding in the budget pertains to OTPS, FRR, and housing if the participant has that option. The contracts for state funding presented to the FIs are not enough to cover the amount of funding approved in budgets. We have been an FI for only 3 years. We've had to amend our contract twice. And currently we waited 7 months for a contract amendment. That is not enough to even cover us through the rest of this year, but it was presented to cover us through 2024. Just through research and discussing with other professionals and other people in the field, we're not the only FI that is being affected by this. And I feel that OPWDD is approving these budgets, so they are seeing how much money each FI would need, but yet it is not being given to the FI. This eventually will become a disservice for the family, as the FI will continue to provide the services and reimburse funding as needed. But eventually the FI's stream of funding will run out, and that will be pushed on to the family. And as an FI provider, and I'm sure others feel the same way, we do not want to do this. This issue is something that needs to be resolved with this strategic planning. Thank you.
Thank you very much. And that concludes our list of speakers for this evening. As a reminder, if you have not had the opportunity to submit your comments to your regional contact, we invite you to do that. And at this time, I'd like to turn the program to Commissioner Kastner for closing remarks. Commissioner?
Thank you. And thank you all for spending the evening with us and offering us your insight and sharing your personal experiences about our system. Obviously, there is a lot of work that we need to do. We will incorporate your comments into our 507 plan. We have obviously not yet completed the process of collecting information, so this is going to take us some time, but there will be a draft that'll be circulated, and hopefully you'll be able to see your comments and your work expressed in the plan, and also to be able to give us additional feedback on what we've produced. So at this point, I'd like to close the meeting. Thank you again for helping us and for speaking with us, and we look forward to speaking again. So thank you and good night.